actually did a lot of research. This whole process has taken, I think I started 5 years ago. I found another organization initially that it didn't work out. I really wanted to feel confidence in who I was going to. And I'm a big proponent of rescue animals. And this organization was mentioned in an American Diabetes Association article. And I did some research and found some articles by Jennifer. And she is a behaviorist, an animal behaviorist. She's brought the best, I think, of both worlds into this organization by finding animals that have the ability to do more for people than the average dog. But she also understands what it takes to be a service animal, and when the going around and finding rescues, the fact that this animal was in a rescue, Banjo, he should be the poster child for rescues, or he could be the poster child for positive reinforcement training. He's an amazing animal, but he's also a product of the support and the effort that this organization puts forth in their animals. No contest when I learned everything I did about Medical Mutts that I was gonna try and get a dog from them for my diabetes. I've had diabetes since I was type 1 diabetes since I was 8. I knew there was a diabetic camp counselor of mine who was pulled over when he had a low blood sugar, and he was thrown in a jail cell for drunk driving. He's lucky he's alive. He's lucky he was able to tell me that story. Of course, he should have been there should have been some way but he couldn't even talk. He couldn't express his thoughts clearly, which is exactly what happens. And the longer you have it, the less you feel it. The technology has come forward, but it's not where it needs to be yet. And those situations where you have a really rapid drop, or you have a mistake with the machine, or your continuous glucose monitor, which tells you your glucose level all the time, comes out, and you're trying to manage finger sticks and you think you're fine, and all of a sudden you can't talk and can't express your thoughts, and that's a really scary thing. So Banjo, the dog that I have, can alert me to these changes. He can smell it.
Good boy.
Yes, Banjo. Press it. Banjo, press it.
Because he wanted to poke me earlier, and I was wondering, or hi.
Yeah, I'm 200 going up.
Yeah, so he was trying to poke me, and I was noticing he was.
Yeah, he was good.
Caught it before the machine beeps. That kind of safety net is huge. I live alone. I often work in a studio alone, and knowing that he can alert me before it's dangerous, it's terrifying. I'm kind of scarred from all the close calls I've had to, losing my life. It's a really scary thing, and it makes you afraid of worse. At the same time, you don't want highs because you don't want damage to your eyes and your kidneys, and so it's a balance. It's a lot to take in. It's a lot to deal with, but I feel like this organization is not only are they doing good, they're rehoming rescues who don't make it to be a service animal, for whatever reason. So they're taking those animals and they're training them vigorously and giving them a good experience, and then giving them a home. And the ones who are, who make it, like Banjo, he's gonna be able to come home with me. And I feel really good about that.